Spleen 9 is located in a soft, tender depression distal to the medial knee. And the easiest way to feel it is to take a couple flat fingers together, 2 or 3 flat fingers, and slide your fingers up along the bone of the tibia on the medial side. You don't need to use a lot of pressure, and people tend to be more sensitive on the medial side. As you slide up, the shape of the bone is going to push you more medially, and what you want to do is just follow the shape of the bone as it pushes you medially. And where you want to end up is the softest, squishiest, most tender depression around this area, distal to the knee crest, the crease of the knee on the medial side of the knee. This is one of the bigger points in the body, physically in size. Some acupressure points are really, really tiny, really as tiny as an acupuncture needle, and some points are bigger. This point can be as large as a dime. You might even feel like a whole quarter-sized, soft, squishy depression in this area, and ideally you want to be in the center of that soft, squishy spot. So, what you can do is basically just recheck by sliding up again and seeing where your fingers get pushed medially. And a double check is that you want to be distal to the crease of the knee. And then you can gently palpate the area, and you're going to feel a soft, squishy bowl where the tissue in this neighborhood is softer. And it also happens to be more tender. It's tender on almost everybody. And particularly women. Almost all women have a very obvious, soft, squishy spleen 9. On men, sometimes it's not quite as big of a soft, squishy spot. And then you want to go right to the middle. And you can gently verify. You can verify with your client if the point is tender, but be gentle about it because it could be quite tender if you use deep pressure. So is that point a little bit tender?
It's not really that bad.
Okay. Compared to this tissue around it, does it feel more sensitive?
Mm-hmm. Mm-hmm.
So we're definitely in the deepest part of the bowl of a soft, squishy spot there. So like stomach 36 is just looking forward on the wrong side. If you look on the medial side, it's very easy to find, and that's spleen 9. And you can also check if you're on a good spot by using a tuning fork to feel the vibration sinking into the tissue. Oftentimes this is a damp and deficient point. And if you put the tuning fork on the tissue around, you'll feel the vibration differently than when it's on it. You can actually see her tissue responded differently too. So I pressed the points around it with the same amount of pressure, but spleen 9 responded to it right away. It had a chi response, and it turned pink.